In order to analyze the knee, I would want to start by checking ranges of motion and making sure the knee is moving normally. So I'm just going to have the patient lay down with their legs flat, and I'm just going to bring their legs into normal ranges of motion and look and make sure there's no pain in passive ranges of motion. We're specifically looking at their right knee, so we'd want to check right knee rotation, right knee internal and external rotation. We're also going to check for normal motion of the tibia, as well as normal motion of the tibia on the femur. We then use some tests or some motion to check the fibula and make sure that the fibula is moving properly, using dorsiflexion and plantar flexion to move the fibular head, the fibula head. We'd want to check for patellar motion. We can check to make sure there's motion and there's no pain with motion. We can also do palpation and make sure that there's no pain along the joint line. And then in order to see if we have a posterior tibia, we're going to do a muscle test. We're going to bring the foot straight internal, and we're going to try to pull out, hold, good. I'll show that again on the left. You're gonna bring this in, and then we're gonna pull out, hold. If that was weak, it could indicate a posterior tibia. If the fibula isn't moving, that could indicate a fibula, as well as we have a muscle test for the fibula, and that's gonna be up and out. And then I'm going to bring him down and in. Same thing here. If we go up and out, we're going to go down and in, and that could tell, if that's weak, that could tell us that there's a cuboid or a fibula subluxation. And then we would do all of the rest of our tests to check. We can use orthopedic tests just to make sure that there's nothing torn. And then we can bring the legs up onto the table. We can check the fibula by bringing the feet together and checking the fibula levels to see if they're the same. If one's anterior or posterior, that could indicate a fibula subluxation.